So there are some variations of our medication that may not result in shedding. So for example, with our topical Happy Head formula, it usually comprises of 3 different ingredients: finasteride, minoxidil, and retinoic acid. So if some patients are very fearful of shedding, we could just either reduce the minoxidil concentration or completely take it out. So you only have the topical finasteride in the formula. Also, with respect to the oral medications, again, finasteride is less likely to cause shedding compared to oral minoxidil, and oral spironolactone is less likely to cause shedding compared to oral minoxidil. So those are the other alternatives. Again, remember, shedding doesn't happen in everyone. It happens in less than 5% of patients, and it's usually short-lasting, usually between 6 to 8 weeks. So even majority of people that do have the shedding, they do very well. There are also some patients that are on the Happy Head medications for 6 months, and they're seeing amazing results, and all of a sudden they go through a shedding phase. Why is that? Well, that's actually normal. You have to realize that hair goes through many different cycles. So you're gonna have some months basically that you're doing great, and then you're gonna have 1 month basically they're just shedding more. So, and that's normal. It's kind of like the stock market. You're gonna have days that are good and days that are bad. Hair is the same way as well, and you could go through a shedding phase despite the fact that you're doing really well. So don't worry about it, just continue the regimen. Also, we also hear from a lot of our patients that they want to grow more hair and they start medication, now they're shedding more, so what's going on? And they're all confused. Remember, shedding is a normal part of your hair cycle. And any medication that is going to cause hair growth could also cause that reset. It could press that reset button where you're shedding initially very fast before you grow more hair. So don't let that worry you. And also, when I see patients in the office, when they're like doing the medication for 6 months and they're shedding more, I always tell them that sometimes the shedding and the hair growing are 2 separate things. So you could still shed and you could still grow more hair. And how do we know this? Because we take a lot of before and after photos and we compare the photos, and despite the fact that patients are losing more hair, they still have a lot more hair than they started out with. So shedding doesn't always correlate that you're losing more hair. You could still be having a net gain, but you could still be shed more. Also, if you have more hair, you also is gonna shed more. So, so there are many reasons why people may be shedding, so that should not discourage you from using the product. And a lot of times, basically, it's just important to be consistent with using the product, and you will see basically the net results later on. And if you're ever worried, just reach out to your doctor.